Welcome to the Objective Tools for Tracking Brain Degeneration to Regeneration. And I have to read the disclaimer. The information in this workshop is not intended, nor should it be used as a substitute for standard medical diagnostic methods. Any recommendations are the opinion of Global Health Solutions, and clinical judgment must be adhered to based on the healthcare provider's scope of practice. So the standard heart rate variability values can be used to validate the effects of other modalities and lifestyle changes. The rest of the parameters come out of scientific research from Soviet scientists and Global Health Solutions observations and innovations. Currently, neither the HeartQuest or BrainGauge are FDA compliant. So here it is. Here's our company, the Health Detectives Toolkit, and it's me. I'm Dr. Michael Kessler, and I'm here with Dr. Sandra Bicchetti. We've both been in private practice for over 35 years, and we've created the Health Detectives Toolkit to educate health professionals. And we have a living laboratory, which is really where we still see patients. So that way, when we have these technologies to play with, we can actually use them on patients and then be able to teach you what we find, and just make sure that these modalities are going to work for you in your practice. And we supply you with technical support and amazing health tools to impact the lives of your patients. This is our other company, Global Health Solutions, where most of you are familiar with us because of the HeartQuest, which is a functional evaluation tool, and that's made up of all three of us. That's with Dr. Javdat Karimov, who's one of the designers and innovators. And today we're going to show you a case, and we're going to use these modalities to be able to track the patient's health from the beginning to the end. So here's the patient, and we have permission to use his information, and here's his history and timeline. So he was in Iraq, and this is his first tour in 2011, and he had a head injury where his vehicle drove over an IED, it blew up, and he had a traumatic brain injury with a concussion. 2012, he had another traumatic brain injury. He fell off a ladder and cracked his head open, had a seizure, and in 2012 to 2013, he had a second tour of Iraq where he was walking, and the soldier in front of him stepped on an IED, and it blew up, and it sent him flying backward, and he had another concussion, right? Another mild traumatic brain injury. Now, you can imagine, when you're going through things traumatic like this, things are going to happen emotionally. And he had not just the TBI, but he also had PTSD, okay? And in 2012 to 2013, at that time, he started, using drugs and alcohol. Okay, and in 2015, he had a second seizure. And the last 2 years, he's been on Cymbalta. At the time I saw him, he was at 20 milligrams twice a day for the last 2 years, and was, once in a while, he was dabbling with a little CBD. It seemed to help him a little bit. And now, he's off the alcohol, which is fantastic, and he's off any kind of drugs except for the Cymbalta, which he's starting to wean down on, that he's now substituting sugar for alcohol, okay? Now I want to read you a little bit about what happens with a traumatic brain injury of this type. And you can see here, these are different scans. These are different PET scans, and this is one of a traumatic brain injury with PTSD here. And it says here 20% of the 2.3 million troops deployed to Iraq and Afghanistan since 2001 could have suffered a traumatic brain injury as a result of exposures to IEDs. An IED fashioned from a 120 millimeter artillery round creates blast winds of up to 330 miles an hour, nearly 100 miles an hour faster than the highest natural wind speed ever recorded. That's tremendous force. These winds reverberate and cause a whiplash bobblehead effect on soldiers. It says similar to chronic traumatic encephalopathy, where Chronic traumatic encephalopathy, a serious brain injury associated with the repeated blows to the head sustained by football players, boxers, and hockey players. So here we are. Now we want to see what this brain looks like. We're going to take a measurement. And before I go on, let's explain a little bit about this technology.
So what we're going to use is an objective piece of equipment called the brain gauge. And it is shaped like a computer mouse, however, it has two little buttons. And these buttons are meant to have your two fingertips on them. And they will vibrate at different speeds, different times, different lengths. And this will test different parts of the brain. So when adjacent regions are activated, they interact with each other in predictable patterns that affect your perception of how the vibrations feel. So by changing these vibrations in different ways, and then by asking questions, which are on the computer screen, very specific questions about what you feel, we can then objectively measure these interactions to figure out how the brain is working, get an objective score of how an individual's brain is functioning.
That is great. Thank you, Dr. Bacchetti. And we're just going to give you a quick look. We're going to show you in just a minute. This is his score, by the way. This is his first reading. I think that was January 12th.
June 12th.
Excuse me, June 12th. And you're going to see that, what we want to see is we want to see these green lines like this going all the way across as far over as possible, where you see 100% all the way through here. So you can kind of see different areas really easily that are kind of low and not where they should be, right? There's an injury. There's something there. There's something not functioning, let's say, in that particular area of the brain. And here's what we have.
So we see that the speed is measured at 30 when it should be 100. And speed is involved with frontal lobe activity, motivation, memory, communication skills. And poor speed scores often indicate neurodegenerative disorders in the frontal lobe, such as a traumatic brain injury.
And just for a sec, remember this, and this just is perfect because it picked up this guy, this patient has a traumatic brain injury. In the next reading, Dr. Bacchetti, did you want to tell him about that?
Yeah, the lowest reading on here out of 5 is something called TOJ, which stands for temporal order judgment. And this can be explained more simply is that this score reflects how well your brain is able to keep track of the order of events. And it's involved with the frontal striatal pathways that control executive functions, including decision-making, behavioral control, and information processing.
And this really matches if the patient. He definitely has some frontal executive, frontal lobe problems there, which we see typically in ADD, and this kind of does match him, really does.
Yes.
And the next one.
Yes, the fatigue, poor fatigue scores have been correlated with sleep deprivation, concussion, mild TBI, things of that nature.
Okay.
It reflects how quickly your brain tires during a mentally demanding task.
Very good.
Yeah.
So we went on and we had him fill out some questionnaires that address, it's a functional evaluation of the brain, looking at the different lobes of the brain, from a questionnaire. The ones that really stood out have a lot to do with brain endurance, which kind of matches what we just saw on the brain gauge, having trouble focusing for any length of time. Needs stimulants like coffee for the brain to function. And so mostly a lot of the things that showed up for him have to do with fatigue and focus.
Yeah.
And so I kind of summarized some of this for you here on the left. You want to read that?
So this really describes how he was feeling to us, how he described himself as having difficulty slowing down and relaxing. So it's very accurate, according to him. Has a tendency for anxiety and considers himself to be a type A personality.
Yeah. This patient, he's really brilliant, but his brain is working 100% of the time, a little anxious there. And that's really typical, too, because I do the genetic work, and that's kind of almost like a glutamate person. And so we haven't run his genetics yet, but good chance that he has high glutamate. And maybe we want to calm that down by bringing up the GABA a little bit. We'll talk about that. We also had him fill out the neurotransmitter questionnaire, right? And so I'm just kind of summarize the scores on here for you. So GABA, he scored 11 and is possibly experiencing symptoms of GABA depletion because it's anything over 8. And serotonin scored 24, possibly experiencing symptoms of low serotonin, and anything over 12 gives you a heads up on that one. And dopamine, he scored 7 and possibly experiencing symptoms of low dopamine, anything over 6, but that's all the excitatory, not just dopamine, all the excitatory neurotransmitters in there. Okay, and so we're going to track this again over time. So when we come up with a solution here, we're trying to figure out, okay, so what are we going to do? And then we're going to track it using these tools we just talked about, right? And so one of the things that we're going to use is molecular hydrogen. And we'll show you, because there's a lot of research on molecular hydrogen for brain degeneration and traumatic brain injury. And also, we need to do something for this guy for his neuroemotional stuff, right? So whatever technique that you like to do, whether that's EMDR, brain spotting, any of the psycho-emotional techniques that you have in your toolkit. In this particular case, I'll show you I used psychosomatic energetics, which is a machine called the Reba, stems out of Germany, and I'll show you the results on that. We didn't use the CBD, but we could have used it, and it's probably a good idea for this kind of injury. We used the PEOs, which are parent essential oils, which we'll explain, that are credible for repairing the cell membranes, increasing oxygen to the brain, and doing wonderful things. The other thing that is new to us, and I think is kind of revolutionary as far as pre and probiotic, is this 364 neurobiotic and this 365 neural prebiotic, and we'll show you a little bit about that in this webinar, because those are specific probiotics that are specific for brain function. And, we all know the benefits. We had him do intermittent fasting, which he's doing, and he's doing a pretty good job since the times when he substitutes some sugar in there once in a while. But with the PEO oils, the omega-6 oils that we're giving him, the healthy omega-6 oils, that is, that kind of satiates him and helps him kind of fight those sugar urges that he has, right? And we already know that with intermittent fasting, just to cover that again for you, neurogenesis, synaptogenesis, synaptic plasticity, cognitive function, motor function, reduced inflammation, and enhanced autophagy. For those that don't know what autophagy is, that's where we take our old cells, old proteins, and we kind of dissolve them, and we can not repair them, but we could refurbish them and reuse the parts of the cells that we need to, and make kind of shiny new cells and healthy cells. And when we talk about autophagy, we're also talking about mTOR, because when you're an mTOR, you're building up the body and you're rebuilding the body. It's talking about cell proliferation, and we're talking about cell growth. And a lot of the population has too much mTOR because there's so many things that stimulate mTOR, and those are things like people that are drinking too much dairy because it has insulin growth factors in there, if we're exposed to pesticides, or we're getting too much folate because they're fortifying our food with folate. And there's a lot of things out there that stimulate mTOR, excess protein. A lot of us have protein shakes in the morning. But if we have too much of that, then we're not going to be in autophagy, and we're not going to be able to clean out the debris. And we're talking about the debris and the cells of our brain in this particular case. So we want to do that intermittent fasting and do more autophagy, okay? Sometimes people will go back and forth between mTOR and autophagy, but again, the point is when we're in too much mTOR, we're producing too much inflammation as well, okay? And so we know that intermittent fasting helps with decreased resting heart rate and increases, which we're going to show you, heart rate variability, which we're going to measure, decreased blood pressure, increased insulin sensitivity, and we're going to make more of those ketones that the brain prefers when you have over sugar. So we got to get him to cut down that sugar, but he's doing a really good job on the intermittent fasting. Okay, so I think I'm going to stop at that. And the exercise on the other side has very similar things that it's going to improve, including brain-derived. Both of them will increase brain-derived neurotrophic factors. So it's something that's really important because that is going to protect our neurons and synapses and make new ones, protect the old ones and make new ones. And it says here, fitness experts say your muscles need plenty of rest between workouts. Well, your last workout was 17 years ago. So anyway, I threw that in there. Now, when we talk about molecular hydrogen, this is a great article in PubMed. Molecular hydrogen in drinking water protects against neurodegenerative changes induced by traumatic brain injury. So when we talk about molecular hydrogen, it's, you get a little capsule, right? And you put it in a bottle of water, and you fill that water up to the top. You put the capsule in, you seal it, you wait 15 minutes, and you'll see these little bubbles. It's gassing. All this gas, hydrogen gas, is going into the bottle, and you drink that. And it says here in this abstract that traumatic brain injury in its various forms has emerged as a major problem for modern society. Acute traumatic brain injury can transform into a chronic condition that can be a risk factor for neurodegenerative diseases such as Alzheimer's and Parkinson's disease, probably through induction of oxidative stress and neuroinflammation. Here we examine the ability of the antioxidant molecular hydrogen given in drinking water to alter the acute changes induced by controlled cortical impact. So that's CCI, is controlled cortical impact. A commonly used experimental model of TBI, we found that molecular hydrogen reversed this controlled cortical impact, induced edema by about half, completely blocked pathological tau expression, accentuated an early increase seen in several cytokines, but attenuated that increase by day 7. Reverse changes that have been seen in protein levels of aquaporin. So let me just stop this for a sec because it gets a little technical, but basically it's very selective and will reduce one of the most damaging free radicals that we have called hydroxyl radicals. Right. I need to take some more molecular hydrogen. Hydroxyl radicals, very damaging. And again, just not to change the subject, but I will just a second. A lot of people have problems with regulating iron. And it's a big problem. It's a big problem in the brain and in the body and in people that have chronic illness sometimes, because some of them have certain genetics where they can't get the iron out of the tissues or cells very well, and it gets oxidized and creates these really damaging hydroxyl radicals. And so this molecular hydrogen will turn that into water. Okay, very, very powerful stuff. Not to mention that molecular hydrogen stimulates ghrelin, which we find is very low in most, autism. It's very low in Alzheimer's and Parkinson's, and it has a lot to do with stimulating memory and concentration. And so molecular hydrogen kind of drives that up. Yeah. Now, the second thing that we're going to give them besides the molecular hydrogen is these parent essential oils. And the parent essential oils are mostly healthy organic seed oils made of omega-6. And if you look at the tissues of the body, this is very important. If you look at the brain and nervous system, and you look at the percent of total body weight, most of that is made up of, look at that, 100 to 1 omega-6 PEOs to omega-3 PEOs. Mm-hmm. And a lot of the tissues and mitochondria we'll talk about, the cell membranes are mostly that omega-6 and a little omega-3. So too much processed omega-6 in the diet, from soybean oil, canola oil, corn oil, cottonseed oil, is what becomes what people's cell membranes are going to become. They're going to be made of these kind of oils that we call renegade oils. They don't work. Our cell membranes are not going to work, and we're going to talk about that in just a minute. And that's vital for the health of, and in this case, the brain. Omega-6s make up 33% of your cell membranes and 40% of your mitochondrial membranes, where we make energy to run the whole show, the whole body, for ATP, energy for the body. And it's going to, if we have that right consistency, it's going to increase oxygen into the cell by 30%. So what's so important about healthy cell membranes?
Well, for one, they allow the nutrients into the cell to generate more ATP, which is the energy battery of the cell. The cell membranes incorporate hormone receptors. They're involved in waste removal. The cell membrane dictates by its distributions of essential fatty acids if you have fluid or rigid cell membranes. When your cell membranes and mitochondrial membranes are strong, it is difficult for viruses, bacteria, toxins, mold, and other chemicals to create disease. They're important for proper communication between and within cells. Genes are turned on and off based on healthy functioning of the cell membranes. It is the cell membrane that changes epigenetics. Good membranes equals good gene expression. The cell membranes are the brains of the cell. They also maintain the proper electrical potential for healthy cell function.
Yeah, so maintaining a healthy cell membrane is just vital. You can't be healthy without that. And most health issues, serious health issues, those are the patients that really, they don't have good cell membranes. They're made of, again, almost like plastic membranes, because a lot of times the crummy diet and the processed food and those fats become part of your cell membrane. And so everybody's talking about hormones. Well, those cell receptors are not going to work properly if you have crummy cell membranes and they're inflamed cell membranes. And so in this case, we're going to give this patient a specific type of fatty acids called parent essential oils, which we'll explain. These are some of the benefits of using these essential fatty acids. And in this case, I'm just going to turn to brain health. Better clarity, better focus, improved memory, helps with ADD and ADHD. And when we talk about inflammation, less arthritis, less joint pain, and swelling, which we've seen quite a bit in our patients who use this. And again, what is this patient doing? Because he's, substituting what? Sugar, and for the alcohol, right? Less sweet cravings, lowered blood sugar, less neuropathy and retinopathy. And again, I want him to not crave those things. So appetite, less cravings, less hunger, better appetite, all those kind of things. And there's more. There's a lot more. But that's just some of the things and why this is our reasoning in giving him these particular parent essential oils. The other strategy that we're going to use is we're going to give him the right type of pre and probiotics that affect brain function. So, we know your body is mostly microbes, and 2 to 5 pounds of your body weight consists of bacteria. They outnumber us 20 to 1, and 100 trillion friends you didn't know you had, right? So these species that we have in our gut are really important factors in our mood. And so here's one, gut bacteria and depression. And in this one is a study that they did using a probiotic supplementation for 8 weeks compared to placebo. And they used Lactobacillus casei, L. acidophilus, and Bifidobacterium bifidum. The probiotic supplement was associated with, look at this, reduced depression scores and the Beck depression score, reduced serum insulin, and reduced inflammatory markers, which is measured by the C-reactive protein. So here we are. We're going to use a revolutionary pre and probiotic. This was created by Shane Morris. I think it's from Systemic Formulas. And it's a probiotic that has highly unique, that has 15 specific, I think it's actually more than that, but I'm not sure, maybe 17 specific species that can communicate with the brain to elicit a very specific outcome that will improve mood and improve overall brain function. So the name of this product is Neurobiotic and Neuroprebiotic. So we're going to give this patient these formulas these species. You can see that I didn't list all of them. These are just some of them, and you can kind of read them there. Here they are. And it really says, do not attempt to adjust the picture. We control the transmission. You are about to participate in a great adventure. We will control the horizontal. We will control the vertical. Sit quietly, and we will control all that you see in here. Because these bacteria are really in control. If they can control our mood, that's probably kind of wild, right? Yeah. And so each one of these species that I have listed here are going to affect and been researched to affect concentration, anxiety, depression, and on and on and on. So this is an incredible formula that I give a lot of credit to Shane for creating this. So we're going to give him that. The other thing that we're going to do with this patient is we're going to use a psychosomatic technique, psychosomatic energetics, it's an emotional technique. And so what we do with this, it's kind of a biofeedback device. We get kind of like an energy blood pressure test on him. We could measure the body's vitality, tells us, how vital this person is, and he scored 70% there. So he's a young guy, and that makes sense, right? Emotional body, kind of your happiness quotient, and he scored 70%. He's kind of really outgoing, upbeat. I didn't test the mental body because that's really about cognitive. This guy is really smart. Causal body, it's kind of giving us a clue about his overall consciousness. For example, somebody who scores maybe 40% on this test may be a little bit more narcissistic, a little bit not really concerned about other people, and more focused on more egocentric in themselves. He scored 60% on this, okay? And so again, just to reiterate, his vitality was 70%, so, it says 40 to 70%, can feel a little tired. He does kind of in the midday, kind of, we'll look at his heart quest and you'll see what, his adrenals need a little help. Emotionally, lack of drive and joy. Okay, 70%. So he's in that realm there. And causal was 60, in that sensible, intuitive, in that range. He's a little under that. You can see that, between average and there, right? And so we're going to measure the different energy centers with this device through harmonization of the 7 regulatory centers traditionally associated with the chakras, permanent resolution of blocks and restoration of autonomic regulatory capability of the sympathetic and parasympathetic nervous system can take place. So he tested for something called Shavita-6. This area is associated with the pituitary gland and regulates the hormonal functions within the body. The energetic function is to create harmony and balance in one's life. Okay, that kind of makes sense. Now, this is like really, really targeted. I find this is an amazing tool, and this is what shows up for him. And he says this is just amazingly right on. Your mind is constantly active. You think about your obligations, and it seems that your thoughts never take a break. This is true of this guy. 1,000 thoughts roll around in your mind. You have difficulty relaxing. You may experience tension and restlessness, worries, crowded thoughts, absent-mindedness, or mental nervousness. And he scored on this. This was the remedy that actually showed up for him. And this is exactly what this remedy is for. And we can also measure how strong this conflict is affecting him. So the lower the score, the more recent that conflict is. He scored 60% on this particular conflict. So it's still quite high. 80% is the biggest one usually we see, so there's probably something else, but he has to clear this one first. And he also scored for an acute remedy from the same company, and it's called Anxiovita. So this is to be used on a regular basis, and this is used in cases of anxiety and nervous tension. It works to prevent anxiety and provide relief during acute states of anxiety and or panic attacks. So a lot of you who followed me and Dr. Becchetti on the Heart Quest seen this a lot. It's not the strongest of the species that survives, nor the most intelligent that survives. It is the one that is most adaptable to change. So here we are. We're going to look at the Heart Quest. And I'm not going to go into depth. I just kind of give you an overall. We're going to look at these different scores here. cardiovascular adaptation, autonomic nervous system regulation, which is your autonomic nervous system that regulates all your body's functions without you thinking about it, for those who aren't physicians. Neural hormonal regulation, that's kind of like your HPA axis, adrenal thyroid, that whole regulation of your endocrine system, and psycho-emotional states. And we always look to see which is the lowest, because we know that's kind of the one that we're going to target. And what is it? Psycho-emotional, 45%. Makes a lot of sense, right? I'm going to skip through here and just go right to here, because we just want to show you the befores and afters doing the therapies that we just talked about. And we can see that his stress index is higher than it should be. It's at 149, and here's the range. So his nervous system is really stressed, but it's not too bad, but it's over what it should be. His autonomic nervous system balance index is 239. And what's the range here? 35 to 145. So he has a really nice balance between this yellow here, which is his fight or flight that most of you heard about, called the sympathetic nervous system, and the green is the parasympathetic nervous system. And this is the central nervous system, or neural hormonal regulation. These are the areas that are going to regulate your body's functions, okay, and help you adapt, hopefully, to any stress. And it's pretty balanced, except that the nervous system is working a little hard here, and it's working, when we see this autonomic nervous system balance index, it's not flowing very well. It's a little tight on the autonomic nervous system, because the autonomic nervous system, when you're under stress, should be able to go between sympathetic fight or flight and then jump back to parasympathetic function so you can repair, rest, and regenerate the body. But this score kind of tells it all. The score here is 41, and it should be between 50 to 500. And when it's low like that, you don't have the energy or the vitality to be able to dance back and forth to deal with stress. And usually a lot of times when we see that, if you look up here, when we punch down this little icon, it's going to tell you that with vital force, when it's low, they indicate an early stage of adrenal gland insufficiency, which is true with this particular patient. And when we look at his neural hormonal regulation, it says here 47. So it's a little under the range. If we go over here and we look at that, 47, unstable neural hormonal regulation. That's kind of the HPA axis, the hypothalamic, pituitary, adrenal, thyroid, that whole axis, right? And this shows something called the HPA axis distortion. So there's a problem there. We want that to be really in the green, and he's in the yellow zone. So there's a problem in how the body's going to regulate that whole pathway. When we need energy, right? We need energy to run the endocrine system, our hormones, and everything that happens in our body. We need that metabolic energy. And his is in range, but the range is 150 to 600. Somebody his age should be at least in the 200 range at least. So it's not really optimal, let's say. And he's showing up in blue here, which is telling us, this blue kind of gives us a hint that, because this guy likes to train, and when he exercises, he's going to need a lot more time to repair and recover after training. When we look at this, which is called the psycho-emotional state index, it's 50 to 100. He's way under. He's 45. And so when we look at that, it's really kind of telling us that the central nervous system is in a state of exhaustion, which kind of matches what we saw when we did the brain gauge. And let's look a little further here. If we go across here, it's not bad. I don't know if you have any comments here, but his brain is always working all the time, and he's got a little bit.
It's mostly delta, so that's indicative of, could be white matter damage.
White matter damage.
Could be sleep disorders.
Sleep disorders. And the reason I asked Dr. Becchetti, because Dr. Becchetti, when we used to run our clinic, we used to use the neurofeedback and map our patients' brains. Yeah. So she's the expert here on this. And when we look at, I'm going to skip here and go to here, because this is what patients, they want to know that they're younger than their actual age. He's 28, but he's more like he's 31. They're never really too happy about that. What can I do to change that is what they usually ask. And so then we kind of get another view of that first page we looked at that looked at the A, B, C, and D parameters, which is the autonomic nervous system, neural hormonal regulation, cardiovascular adaptation, and psycho-emotional again, which is the lowest. And his overall score is 49%. So he's 18% less than somebody his age. So this is all the baseline before we did all those things we talked about. When we look at his when we look at his spectral mineral analysis, it's kind of low in magnesium. And that would probably be a good idea for him to do some magnesium because that's calming, right? That will help bring down that sympathetic nervous system a little bit and calming for the nervous system, right? His inflammatory index, we want it way over here in the low range, but it's not bad. The thing that really that stands out really is this cortisol to DHEA kind of ratio here. When I see that, I always know. So if they're in the red, that's excess, right? And if they're in the blue, that's deficient. But when I see them spread out like this, cortisol here and DHEA over here, I know that the adrenal glands is needing some help. I'm not going to go into too much depth on anymore. Let's keep going because let's go ahead and look at the meridians. When we look at the meridians, we want to see the total power between 1,500 here to 3,500, 3,500, meaning that there's a lot of energy running through these channels from Chinese medicine. And we're seeing deficiencies in the triple warmer pericardium. That's usually emotional. That can be psycho-emotional when it's red. See red here, deficiency. Blue and purple, these guys are all excess, where there's stagnation, where things are stuck in those areas. And I actually did some emotional work with him, and most of these things that you see here are emotional. The kidneys here that you see here, that's probably adrenals, and this is pretty much an emotional picture. It'd be very interesting once we put this patient on those emotional remedies and do some work there. Yeah. Did you want to comment anything on these meridians here, Dr. McTeddy?
Well, the earth element, the stomach and spleen, there's a huge discrepancy there. Like you said, you did some emotional work with the stomach meridian being 78% and the spleen's only 12. So,
right.
So we want to see more balance in there, obviously. And the water element's very low, as is the fire minister, pericardium, triple warmer. So there are some areas that are very low. But that stomach energy really has to move, as well as the lung energy, which could also be emotional, as we know.
Right, probably is. And then when we look at the energetic centers of the body, and we go down through here, we want to look at the one that's the lowest, and this one right here is the lowest, and we'll show you what that means in just a second. As I pull this up, that's the energy plexus 2. And did you want to just read that one for them?
Sure. The organs associated in this region are associated with the sacral plexus, the adrenal glands, kidneys, large intestines, and sacrum. This region may be involved with regulation of water and adrenal hormones, such as adrenaline and cortisol, maintaining mineral reserves, toxin excretion, and is involved with fight or flight functions. When this area is disturbed, a person may constantly test their strength and capacity until they finally collapse. There may be a tendency to be self-critical.
That was perfect, and he actually felt that was that definitely described him. And there's treatment for that. Mm-hmm. If he wants to use any of these essential oils here, we put that in there and where to place them to help bring that particular energy plexus into balance.
Mm-hmm. Yeah.
And guess what meridians, by the way, are triple warmer pericardium,
really?
Wasn't it? Yeah, right. Mm-hmm. And so now we're going to show you, after we put this patient on the remedies, we're just going to be able to show you the changes. So look at this. This is over about a month, right? So look at every one of these scores. Here's this baseline up here, 53, cardiovascular adaptation, now it's 81. His autonomic nervous system regulation, 49, now it's 93. His comprehensive peak performance was 49, now it's 80. His neurohormonal regulation, 47, now it's 74. And the psycho-emotional 45, now it's 71. But remember, it's still the lowest one. It still needs work.
Right.
Now, let's look at this comparison. This is just major change. Look at the stress index, what we talked about before. So now you know what it is, and you can look at the parenthesis to see, this is the normal range. So we see that's way out of range, like we talked about. Look at the stress index now. It is now in range, right?
Mm-hmm.
Now, even though you'll see more sympathetic nervous system function, in this case, it's a good thing because his body's starting to heal. It needs the energy. You have to have that gas pedal down a little bit to move and change to get things to function and change. And so, again, the stress index is probably the first thing that you're going to see change as you're doing good treatment with somebody. And then the autonomic nervous system balance index, which is way out of range, it's now in range. And what is phenomenal and important for me as a practitioner is this vital force. Now he's able to adapt. Now he's able to heal. So look at that. We went from 41 to 246. That's huge. When we look at his neural hormonal regulation, it's dropped into the green zone. See that line here? And you can see that it went from 47. It's not in range. See the parenthesis here? 50 to 100. Now it's in range. It's doing much better. And you can even visually see the metabolic pyramid. Look at that. He was 157. Now he's 278. So he's got a lot more energy necessary to make ATP and to make things happen, to make changes in the body, because he now has more energy, right? The brain is improved. Psycho-emotional state index, 45, now it's 71. He probably still, the serotonin, is, all these neurotransmitter indications that give us clues. I'd still say, the dopamine seems to have improved, but, the GABA is still a little bit on the low side there, and I might want to do something with that. Either I'm going to give him some maybe liposomal GABA, or I'm going to give him some precursors to help him make GABA. My guess is that he's probably having a problem taking his glutamate and turning it into GABA. And I can see that if I do genetic work with this particular patient. When we look here, this is what's really interesting, though, because his brain is working all the time. Kind of, you got the picture of this particular patient, right? So we're looking here, and you can see this high beta here. So, his brain is going over and over, looping over and over, and the thought process and a little bit of anxiety. You can still see that there. And that kind of goes with that high sympathetic picture that we just saw in the pie with the big yellow there. But look at his age now. So his age, he's 28 years old, right? And the first time he was more like 31 years old. And now he's more like 25 years old. He's coming down. His health is starting to go in the right direction. So I know the therapies that I'm using are effective. Really important.
Yes.
Peak performance went from 49% to 80%. The magnesium is still low. We still want to deal with the mineral ratios here. The inflammatory index got lower, but you can still see, the cortisol and DHEA, cortisol came in. The DHEA is, it's better. But I still think this patient will need some adrenal support. Do you want to comment on anything on the meridians from before and after?
Well, the total power improved quite a bit. So there's more energy flowing through all of the pathways, all the meridians. And although the stomach is still got some stagnant energy, it's not as bad as it was. Looks like he still needs some support in the adrenals, like you said, and those low areas are still low, but it's looking a lot better. There's
Look at all
more
the green.
green.
Look at all the green. Green is normal.
Lungs are normalized. Looks like the small intestine might be a little bit stagnant.
Yeah. And when we talk to the patient, he's already feeling better. A long way to go, but he's feeling better.
Yeah.
And when we look at the meridians, look at the, well, there's still a little bit imbalance still
it's not as bad.
but it's not as bad
Yeah.
between the stomach and the spleen.
The heart meridian's low. Now again, that could be emotional. The heart has to do with happiness. The heart meridian. So there could be some things there.
Yeah. So he hasn't started yet on these Reba remedies yet,
That should
and
be
I
interesting.
really like to see what's going to happen. But I have a feeling a lot of these scores will improve as he's doing more of the deep emotional work.
That'll be interesting.
When we look here, all the scores. Look at that. All the scores from here to here on the post-test. Look at that. All the scores have gone up considerably, right?
Mm-hmm.
So what is the lowest ones here now? Interesting. They switched it. They're in the brain, right?
Yeah.
And we just tested them on the different energy centers, right? And the main energy center is at the top, right up here.
Yeah.
Right here. That's so. That was the 6th pituitary area, and so I thought that was very interesting.
Is that 6 or 7?
You're 7, there's 6. Yeah, so so the top, the crown seems to, but everything's in the head. This is where the guy hangs out. He's in the head too much. He's definitely in his head.
Yeah.
Now, this is what gets real interesting. And this is the first time we ran the brain gauge on him, right, on June 12th.
Mm-hmm.
And this is July 26th. And you can see it's going in the right direction. It's going up. This line's telling us which direction the brain function is going.
Mm-hmm.
Now, here's before and after. Do you want to say anything? Do you have any comments on that one, Dr. McKetty?
Looks a lot better.
Yeah, we definitely see that this has improved immensely already.
There's no red. There's no orange.
Pretty
everything's
balanced.
kind of working together to improve.
So, the one score that we like to look at is the cortical metric score, because that's the overall score of looking at this whole thing, right? And look at that. It went from, what is it, 50 to 80. So we know that the brain is functioning much better. This is very consistent.
The other important ones, the fatigue and the focus, they were in the 50s, and now they're both 100%. That's pretty amazing.
Yeah, and I'll tell you honestly, I think the scores could even be better because he came in a little later than his appointment after a full day, and he was probably a little bit tired when he ran this test, and he still did really good.
Great improvement.
Great improvement.
Yeah.
Now, Dr. Paquette is going to talk to you about this incredible device, and go ahead, Dr. Paquette.
So we did another test using a device called the Brain Paths, developed by Patricia Derrick, and she asked us to evaluate her tool and see how it would show some improvement, and possibly using objective tools. And so the Brain Paths is a very interesting device. It's basically a plastic disc that has different paths and shapes embedded in it. And what you do is, it's great for people that are unable to do a lot of other things, like people in long-term care and things like that, because you just have to trace your finger over these lines, and what it does is it stimulates the brain via the sensory receptors on the tips of the fingers, which are numerous. So what we did was we took a baseline recording using the brain gauge, and then we had this person use the golden colored one, called the Masterful Voyage. And it was used not that much, because you don't really need that much, but several times during a week's time, one day a couple times there. And we wanted to see what would happen. Now, this person didn't change anything else in their supplement regime or their diet, their normal daily routine. So we wanted to see the consistency of the results. So let's see what happens.
Well, what we're going to do before that. Before we're going to show you a little bit of a movie, hopefully.
Our fingers are the tuning forks to the central nervous system. 3,000 mechanoreceptors lie in each fingertip, connecting the central nervous system together like a highway. Signals from the receptors travel along the nerves to neurons in the brain that humans associate as stimuli, like hot, cold, pressure, and pain. Created in the mid-1800s, the tactile system of Braille made it possible for blind people to utilize their sense of touch to read without seeing. This learning system trailblazed a foundation for new scientific breakthroughs and studies which could unlock the mysteries behind the power of touch and learning.
There's as much sensitivity in one hand as the entire trunk of the human body. This is because of 3,000 mechanoreceptors in each fingertip that provide a superhighway to the sensory motor cortex to stimulate the brain.
Cases of neuroplasticity or rewiring are shown when patients exercise certain areas of the brain with stimulant exercises. Like a muscle, the brain has the ability to regenerate itself and grow its capacity to learn skills.
To exercise the brain is to challenge different senses externally. And this can be music, it can be computers, it can be puzzling, it can be sensory stimulations of the fingertips, it can be sensory stimulation of the face or the tongue, it can be mathematical challenges. So the bottom line, the brain needs to be challenged in order to increase the neuroplasticity in the brain.
The nerve is the means for communication of the world in that we live, and also it sends messages to the muscles. And so the nerve brings together the sensation and also moves the body. The brain path brings together both the sensory input and the motor output. And it's very effective as a learning mechanism because it gets to the very center of who we are, namely the nervous system.
Incorporating the methodology of Braille, BrainPaths offers individuals a soothing, non-surgical exercise involving patterns and textures injected into a plastic surface. Individuals use their fingertips to follow the patterns in a repetitive motion, much like exercising a muscle, which stimulates the sensory and motor cortices of the brain.
Tracing a BrainPath device reorganizes the brain to adapt and find new ways of learning, increase synapse connections between neurons, increase memory, improve cognitive abilities, and release anxiety, depression, and stress.
The fingertips is one of the areas in the body that it has a direct path to the brain. And use it as early as you can. It doesn't need education. It makes the child concentrate, and it helps the brain to build a new area or increase the brain map area. So it can be used in early age, but I also recommend it for across the way, even in older people, because this will provide the brain the stimulus that some of the brains need.
Registered and listed with the FDA, BrainPaths is a non-invasive instrument to help dexterity and refine motor skills for individuals looking to find an accessible and affordable way to exercise their brain. There are no electrodes or prescriptions required to unlock the true potentials of the human mind.
I use BrainPath every day, and I find that it helps me more than any physical activity in terms of the acuteness with which I can control my movements of my fingers, which is very important as a surgeon. And secondly, it allows a better communication because much of my examination of the patient depends upon what I palpate, what I can feel. These fingers are my inroad into the pathology. What better training could I have than using the BrainPath?
My mission is to get BrainPaths in every home, every school, every nursing home, every hospital, because BrainPaths provides an alternative, a safe, non-invasive alternative to stimulate the brain without using electrodes. It's safe, it's easy to use, very inexpensive, and available for everyone.
To learn more, visit brainpaths.com.
So it's amazing that such a simple tool can be so powerful. But,
Really is, and it's so easy to use. Everybody should be using it.
And it's so inexpensive, and it's just something you can do while you're watching TV. And there are different types. One of them is actually a maze that you find the beginning and the end. So that's for somebody that's maybe has that capability. So it's really an amazing little tool.
Can you want to show them the before and after?
So this is the baseline reading. Like we said before, we used any of the BrainPath's devices, and we see that there are some very low scores here. The speed is very low, and the focus is very low. So the others are, there's some that are pretty good, but the overall score is 69, so a little bit better than half. So then we did, like we said, just the BrainPaths, 15 minutes a day. One day we did it a couple times a day, and then we took another BrainPath reading. a brain gauge reading after using the BrainPath. And this is the after use.
Yeah, I'm going to go before. Here's before.
And you can see the speed was 7, the focus was 9, and now the speed came up. They both came up, so there was really good improvement there. So
that's pretty cool.
It works. There's many ways, as the doctors were saying in the video, to stimulate the brain. But this very simple device is definitely a good adjunct to other things somebody's doing.
Right.
And
we have that available. The the Health Detectives Toolkit. We have that available for practitioners.
Yes.
Here's another visual, which we before, and there's after.
Yeah.
So you can kind of visually see. Here we are before.
Yeah.
And there's after. So you can see the improvement.
Yeah.
Exactly.
Absolutely.
Here's the other thing. We did it. One last thing. Okay. There's always one more last thing. We also used the AngioScan. Okay, to test our patients. And it says here in this article, breakthrough in clinical cardiology, in-office assessment with pulse wave velocity and digital pulse wave analysis. And actually, this was a study done by Brian Peskin, who developed those apparent essential oils that we use with Robert Rowan, MD, so a lot of you know who he is. And they showed that when given the apparent essential oils, that it improves the scores on the digital pulse analysis. So we go, okay, well, let's see.
Right.
This is what told me. I said, so let me see for myself, right? And so what we're measuring here, so healthy arteries are elastic, and pulse waves from the heart travel through the femoral arteries where they bifurcate. So when the heart contracts, it's going to send out a pulse wave down to the femoral arteries, and then it's going to return back, right? And this is where the pulse wave is reflected back, where the healthy artery reflects back after the aortic valve is closed, during diastole and late systole, thus decreasing the afterload on the myocardium on the left ventricle and improving coronary profusion. So, what happens is as that returning wave comes back, if your arteries are more like a pipe and really stiff, they're going to come back much faster, and the heart's trying to make its next contraction. It's working against that. There's resistance. So the left ventricle is going to work harder. You're going to have less time in actually diastole. So you're going to have less blood flow to the coronary artery itself. That's where it gets its own blood supply in diastole. And so you're setting yourself up, when you have these stiff arteries, not to mention the atherosclerosis and those kind of things. And C artery is actually the best pulse wave that we're looking at. There's A, B, and C. So C is typical of somebody who's, in their 20s, right?
Mm-hmm.
And so anyway, we're looking at this. And we did a test where we did the PEOs. And
I wanted to say that this person, not only were they not taking the PEO oils, but they were taking a lot of things to increase nitric oxide, the typical things that are out there. And every time they were tested, it just didn't improve, and so it was kind of surprising. So we decided to do this experiment with the PEO oils and saturating the person's membranes with the PEO oils, and redid the AngioScan. And we can see that the pulse curve type used to be 100% A, and now there's a little bit of a change, even a little bit of a C. I mean, it's a small amount, but for somebody that couldn't budget before.
Yeah, there was no budge on this person.
Yeah, and you can see the improvement in the vascular stiffness and the vascular age. So it's again very very dramatic.
It is. And, the way to take these oils, by the way, is you don't want to play around with this thing. You want to take it enough of this to saturate all your cells, like we talked about, improve the cell membranes. And so this particular person takes, for every 40 pounds of body weight, they take one of these PEO capsules, right? And interesting enough, it has a little nitrogen bubble in it, so it doesn't get oxidized. It's very cool. So say you took 3 PEOs at 2 times a day. And look at the age here. Vascular age went from 51 to 44. That's pretty dramatic.
Mm-hmm.
And this is, the lower the number here in the vascular stiffness, the better. So the number dropped. That's a really good drop. And this is the average for that person, 21.7%. They're 16.2%. So they're even better than the average for that particular person's age.
Yeah.
So I want to thank you for listening today. And if you want to contact us, it's 415-646-6112. That's my number. You could talk to me. I like to talk to people directly. We have on here, that's my email. We have, if you're interested in talking to us about HeartQuest, that's www.hrvhq.com. And if you want to talk to us about the Brain Gauge, that's www.healthdetectivestoolkit.com. And also the Brain Path is on there.
The Brain Path is on the toolkit site, and the PEO oils and hydrogen are on the
HRV HQ site.
Right.
Okay.
Yeah.
And we're here to answer any questions that you have.
Thanks.
Thank you very much for listening.